Over the next 3 months, the Omicron variant is expected to account for 3 billion infections worldwide. That's as many as during the entire pandemic so far. And yet, there is optimism that this may be the beginning of the end.
I think the vaccines and drugs that are now available can reduce COVID burden by over 95%, so that it's no longer a top 10 health problem. I think it's going to be very difficult to actually get it under control in terms of controlling cases. So we're talking about controlling severe disease and reducing mortality massively. So whilst there still will be cases, unfortunately, they will be much less severe overall.
South Africa, where Omicron was first detected, is now providing intriguing clues about what may happen next. Infection numbers there are dropping fast in a population that's achieved high levels of natural immunity, down more than 50% from their peak. Restrictions are being lifted, and a number of international studies support claims that Omicron is less dangerous, confining itself more to the nasal and upper respiratory passages than the lungs. The infection numbers are enormous, and yet undeniably the public health consequences are less severe. So have we genuinely reached a turning point? Well, plenty of scientists seem to think so, and even the World Health Organization says that 2022 could bring an end to the acute phase of the pandemic. But the World Health Organization cautions that's possible only if the vaccines and treatments available in the rich world are made equally available to all, a goal the world is some way from achieving. And even then, scientific views are divided.
The Omicron variant actually shows us that this virus is very flexible. The Omicron variant is so different to the other variants that we've seen that it's actually able to enter in cells in completely different ways from the ways previous variants used to enter. And what we realize is that the space for adaptation of this virus is quite large. And as long as transmission is allowed to continue, the course of the pandemic is going to be very, very unpredictable.
High transmission rates raise other concerns too. The debilitating effects of long COVID, the continued risk to the vulnerable and the unvaccinated. Increasingly, though, policy thinking seems to be shifting away from long-term control measures towards the view that the vast majority of us may be able to live alongside the virus, eventually posing as much risk to public health as the flu. Jonah, Al Jazeera, London.